Thank you so much for this lovely introduction. I hope my screen is visible to everybody. Thank you, Professor Black and Professor Ahmed, for setting up the beautiful context in a simple and very impactful way. So I take a privilege here to, on the behalf of Save the Children India and Stop Diarrhea Initiative project, which we implemented from 2015 to 2019. And today I am going to share the findings of our pilot study on co-pack of ORS and zinc in India. So as we all are aware about the ORS and zinc, so in India, right now, if we say India, almost around 24 million birds are there annually, which accounts for more than 17 birds globally in the country. And India is estimated to have 208 million episodes of diarrhea, and with 0.1 million under 5 children deaths occurring. And the government of India, the Ministry of Health and Family Welfare, has set up a target of achieving the mortality to less than 1 per 1,000 live birds. It has not been that India has not made a progress in the past. If I see the last national coverage comparing from 2015-16 till last year, the prevalence of diarrhea has been around 7.3 that has come up in the last. But saying that, right now more than 35% of districts, that is almost around 222 districts in the country, they are still above the national average. Plus, if we see on the terms of utilization rate of ORS and zinc, so there is a vast difference in if I find ORS use at 60%, zinc ORS is at the use of 30%, just half of that. So what happens to it in India? So that's why I'm saying I'm thankful to Professor Ahmed and Professor Black for giving such a detailed one. So when we were implementing our project, what we found in the field is that when this ORS and zinc, they are given as a separate entity to the caregivers, the first problem that they face is the adherence to it. In India, till today also, it's very difficult for us to track the adherence to the zinc treatment as it is. So we can get how many children were given zinc, but it's very difficult to get the data that how many children completed their treatment with the zinc and ORS completely. That's a challenge. Second challenge that we faced in the beginning was that most of the time the frontline, especially the frontline health workers, they tend to hold on zinc and they used to wait for a severe case actually. But the recommendation is that ORS and zinc should be given to everybody. So that also caused the delayed action. Another very, as Professor Ahmed very clearly told that, when this ORS and zinc are distributed separately to these frontline health workers, there's a high chance either one of them may be off the stock out, and most of the time we found that the zinc is especially stock out. So especially in India, when we ran campaigns at that moment for a period of 1 month, 15 days, you may find zinc available, but then for the rest of the year we used to struggle to find the zinc with the frontline health workers. Another very aspect is that health workers, especially for the diarrhea treatment, they find it very difficult to intend it, to dispense it, to stock when ORS and zinc they are given in a separate manner. One of the challenges that we are still facing is India is on the legal compliances associated with zinc. As far as ORS is concerned, so ORS is right now out of our Drugs and Remedies Act. This means that it can be easily available, it is marketable, anybody can procure it, purchase it, keep it, sell it, buy it. So there is no hindrance into that. But as soon as it comes to zinc, so zinc, there has been no very clear categorization of that in that term. So for private sectors, if you want to stock zinc or you want to sell zinc, you need to have a separate license for that. But the good part is that within the public health system, this law does not apply. So wherein the ASHAs or Ranganwadi workers or ANMs, they can give zinc on the treatment guidelines offered by the government of India. So a kind of balance had to be established. So what we did into the Stop Diarrhea project actually, as a part of it, we did not procure ORS and zinc actually. So we banked on the government supply of ORS and zinc. And what we did that we developed a very simple co-pack with well-designed messages on it, on the use of it, on the counseling part of it, plus also on the tracking of zinc for 14 days. And After having that, we trained the frontline health workers and ANMs on how to use it, how to counsel it, and how to track it, and how to report it. And this whole co-pack was given to the lowest public health facility, from where these ORS and zinc were distributed separately to the health workers. So we bundled them into one packet, 2 packets of ORS and 14 tablets of zinc together, and trained them, and then offered them to go to the field. So in 1 year of pilot, what we found that the prevalence of diarrhea in the co-package area was almost half of the prevalence of diarrhea in the non-co-package area. Similarly, what we found that on the use of ORS itself, in the co-package area, the complete treatment till the diarrhea got subsidized, we found that more than 80% of children were treated with ORS. And very remarkable finding we found with the zinc. Almost 78% of children, they were treated with zinc when they were given in the form of co-pack, as compared to 20% in the known area. So overall, right now, echoing with Professor Ahmed and Professor Black. So what we found that if ORS and zinc are co-packed together, they tend to improve the uptake and coverage of ORS and zinc both together. Plus, also not only coverage, the adherence to treatment improves a lot. Actually, adherence to treatment, by saying that if you have to follow zinc for 14 days, so that there is a enhancement into that. Plus, also what we found that the health workers, the ASHAs, the ANMs, they found themselves much more comfortable in dispensing these kits all together. So they did not have to worry about counting the tablets and all those kind of, plus counseling became easier from them. On the caregiver's point of view, what we found that the mothers who received these co-packs for their children, they felt very satisfied actually, and they reflected their belief in the treatment, and that also resulted into the adherence of that. So having all these things put in place, in 2019, the government of India runs intensified diarrhea control fortnight program every year. So this whole co-pack design and concept was included into the national guidelines for replication and taking it forward. But now moving forward, I think, in India, especially if I talk of countries like India, one of the top priority that we would be needing is that securing the government leadership for these kinds of co-pack. And if we are able to develop a national plan for the co-pack of ORS and zinc, that would be a long sustainable point it will give. Plus also a kind of a dedicated technical assistance and support, I think would be much needed to the state governments and the implementing teams to take forward this co-pack and impact a larger number of children suffering from diarrhea. And of course, echoing with Professor Black and Professor Ahmed on the engagement of private sector, I think pharmaceutical industries plus the private medical practitioners, they need to bring in the mainstream line of these co-packs and a kind of a campaign for private sector, plus also for demand generation on use of ORS and zinc needs to be prioritized in the country. So I give a pause to myself at this moment, and thank you so much. Over to you.